13 minutes to 10, the Andrew Peach Show till 10. We're talking Bracknell this morning. Henley on Wednesday, by the way. If you live in the Henley constituency in South Oxfordshire, the candidates will be here at this time on Wednesday morning. OK, text from one of our listeners. Please ask the candidates if there are plans to provide out-of-hours health visitors or baby clinics to help working families. I had to return to work full-time in January when my son was 4 months old. He's only ever been seen by a health visitor and weighed twice. I asked for advice from the health visitor over the phone, and her advice was not to vote Labour at the election. Good impartial advice from the NHS there. So we'll ask John Piasecki, the Labour candidate in Bracknell, whether he agrees with that.
I think the short answer is probably I don't agree with that. Out of hours in East Berkshire is a very highly regarded service. It works very well. It is well supported by all the GPs. I think it is under threat if the Conservatives get in, because I'm pretty certain that they are planning to do things to out-of-hours service in terms of pushing it back to the GPs, which I think would be retrograde.
What are you alleging? Let's be open about it, because then we can get a response from Phillip, the Conservative candidate. What are you saying the Conservatives will do? I
think, as I understand it, the Conservatives have every intention of pushing the running of out-of-hours back to individual GP practices, and I'm pretty sure that's not what they would want. What we have in
who would want? The doctors?
What the GPs would want.
Because they'd have to work harder.
I think it's not just a case of work harder. I think it's a case of we have a very, very good, well-run organisation now in East Berks running out of hours. It's highly regarded, and I think it would be retrograde to actually dismantle it.
OK, Phillip Lee, the Conservative candidate. I'll say you're a GP before you do. So you probably have a view about whether doctors have to work harder or not. But is what John is saying right, that if the Conservatives are elected, that doctors' practices will pick up the out-of-hours work again? Because that might be a popular thing if it is.
What I was about to say, I think most of my patients and the constituents I meet actually always decry that they cannot see the doctor that they want to see in their surgery at a time of their choosing. So I think it's probably a positive step, not retrograde, a positive step to have GP surgeries open for longer so that they can offer those evening surgeries for people who actually go out to work in the very services that you...
Labour's done that, hasn't it? Evenings and weekends.
It has tried to. Now, with regards to out-of-hours, there are absolutely no plans to remove out-of-hours, and in fact, yes, East Berkshire has been blessed with its out-of-hours service. Please, you don't have to go too far to find services that have not been so good, and the policy that the Conservatives have is to try and put it back to GPs, because there have been significant problems, particularly in services employing foreign doctors, and that's why we're doing it. I think the scandal, though, and the one thing I'll say on health, undeniably, the Labour government have increased spending on the NHS dramatically in the last 13 years, doubled it. Show me the evidence in this area that we've had any of that money. And let's have a look at the statistics as where that money has gone. We all know it hasn't come to the south of England. We all know it hasn't come to Berkshire. It's an absolute scandal that in the last year, management... It's gone up 17%, number of people in management and the health service. And today we find out 7% increases in senior health manager salaries.
Isn't David Cameron also talking about targeting the NHS funds to deprived areas, which, you know, which read not Berkshire?
In terms of when you actually concentrate funding, it isn't necessarily about funding on acute care. It's about chronic care. Someone's health depends upon their housing, depends upon their diet, depends upon their work. It isn't just about where your casualty department is.
OK, Ray Erica, the Liberal Democrat candidate in Bracknell. What do you think?
Well, I'm not sure where the Conservatives are coming from on all this, because they talk about ring-fencing the NHS and then criticise it for wasting money. I think there's a lot to be said for...
Because I think wasting money is a bad thing. What do you think, Ray?
I think there's a lot to be said for renegotiating doctors' contracts to make sure we get a better out-of-hours service. I haven't had personal experience of using it, so I don't know how bad it is. I do know if you want a GP appointment, you don't always get the doctor you want, and if you do, you have to wait 2 or 3 weeks to see them. Now, that's unsatisfactory and unacceptable, and I think there's a lot that can be done within the NHS. Investment has gone up threefold under Labour, productivity has gone down. We know that Wexham Park and Heatherwood are in severe financial difficulty. They've got to find £50 million a year in savings, so where do we get a new hospital out of that?
Okay.
The whole thing needs re-looking at.
I mentioned one listener's question, another one which is around the same area we're already talking about from Denise in Northlake. What will these politicians do to protect our health services, our A&E facilities and maternity services as well? Let's bring in Murray Barter for UKIP.
What we've seen obviously with maternity services is the migration of much of the service from Heatherwood up to Wexham Park. I think our after-hours care is important and quite good where we are. I would like to see it going back to surgeries, as Phillip has also mentioned. I think people do like to see their own doctor, and that certainly isn't the case. What we've been seeing is government targets also affecting service, where you have to ring on the day of the appointment just to make sure you reach a government target, which is then meaning that the doctor themselves receive their salary based on those targets. And I'd like to see the patient actually coming first and the Hippocratic Oath actually coming to the fore slightly more on